First thing we want to look out for to know that somebody has had a stroke is something we call FAST. F stands for the face. So you look at the person's face, if one side of the face is drooping, or if the mouth has shifted to one side, or somebody who had both sides of the face were the same, now all of a sudden it's like one side is more than the other side, then you know that, okay, maybe that person has had a stroke. The A also stands for the arm. So the person has weakness in one hand, sometimes there's weakness in one leg, then you know that, okay, person may have had a stroke. S stands for speech. If the person was talking normally before, now all of a sudden the speech is slurred, you can barely hear what they are saying, then the person may have had a stroke. And T stands for time, meaning that once you notice either of these things, it's time to get the person to the hospital. And the quicker they get to the hospital, the higher the chance of survival. So when they come in, we look out for these things.
Neurologist at the stroke unit of the Kolebu Teaching Hospital, Dr. David Brodimens, highlighting most commonly exhibited features of a medical emergency. 51-year-old Johnson Deity, who was struck by stroke in January this year, lost some of his primary senses.
I was told that I was a dead person. It was a dead person who was lying down. That is what they see. That is what my relative told me. Also in the stroke unit, when they saw the CT scan, they saw a problem that had in the brain where the blood clot is. And this is called the hemorrhagic hypertension, which is complete stroke and which is dangerous. My family were told that it is a 50-50 affair. When they come, whatever they come to meet, they should just take it like that. If they come to meet a live person who is lifeless, they should take it like that. If they come to meet somebody who is a vegetable, they should take it like that. They have to start everything with me like a baby. Because I could not walk, I could not do anything. I have to be bathed. I was put on Pampers.
But today, he walks and works again.
I, for one, I'm supposed to walk. I'm not supposed to walk briskly. You understand me? And I'm not supposed to walk for a long distance because of my lumbar spine. My doctor told me don't walk more than 50 meters. Don't stand for too long.
With the help of physiotherapists and other occupational therapists, he no longer requires walking frames. Some patients are unable to recover completely from the disability, but occupational and musculoskeletal therapist Kafui Badiga says all hope is not lost.
Okay, so we look at the very ability that is remaining with the person post the condition. Then we are able to structure an exercise program that will progress the person from the stage in which he or she is to, an almost completely normal, person that can actually adjust daily in his daily lives.
With basic routines like blowing a balloon, the road to recovery could be less cumbersome.
There's a bit of occupational therapy here, whereby you have to help the person, the person must start writing like a child with a chalk first. Then something as simple as picking of marbles, just trust me, a stroke patient cannot be able to put both fingers together in the index and the thumb like this to pick something. So something as small as this, you have to learn how to do it. And even how to be able to get them to talk better. So even at times, we recommend that they have gums that they even chew, so that can loosen the tongue a bit and the masseter muscles over here, so it can be loose enough for them to keep talking. Because sometimes when the condition happens, you realize that the person's facial muscles may twitch to one side, may move to one side. So when you start doing that, it helps. Even something as simple as blowing a balloon. You see, when you're blowing a balloon, you have to go, so the whole place will have to expand, tighten, and relax. So when you keep doing that, it opens and expands. So once it does that, then muscular retraining, starts.
Sometimes it takes a multidisciplinary team effort of dietitians, neurologists, psychologists, physiotherapists, pharmacists and other care nurses to rehabilitate stroke patients and give them hope. In the face of frightening cases of incidents of stroke among young people today, health experts are advising people to keep healthy lifestyles.
The risks are your high blood pressure, if you have high sugar diabetes, or if you have high cholesterol levels. So you need to know, you need to check. So you need to go to a hospital and be screened. And nobody is too young to have a stroke. And then also watch your diet, take more fruits, more vegetables. These things have been shown to reduce the chances of stroke. And then exercise.
As the world marks Stroke Awareness Day today, The chorus is, "Stroke is preventable. Do not be the next." Komla Adum, Joy News, Accra.